So hi guys, I'm Dr. Tej Joshi. I'm a certified paragliding pilot, drone operator, and a scuba dive instructor. I'm enthusiastic about speed, cars, and motorsports, and I'm also an avid watch collector. However, I'm here today on behalf of this amazing company called Angelus. Angelus is a company which is based in Brazil, I guess, and I'm here and they have introduced this groundbreaking, amazing post and core system called Splendor. So basically, I'm here to help you guys know a bit more about this groundbreaking and revolutionary post and core system. So before we talk a bit more about this post and core system, I would like to brief you guys a bit more about the latest school of thoughts and concepts behind placing posts. Unfortunately, this topic is not very much talked about at dental schools, and I assume that recently passed out graduates have hardly placed a case or have hardly performed a case or two of post and course. And that was at least during when I passed out. That was the scenario when I passed my B.D.S in my country, and I guess same is the scenario. I had a word with few of my colleagues who are studying, like who graduated from other different countries, and that same scenario over there as well. So talking about post and core, let's get going. You have read this in all the books. Basically, why does what purpose does a post serve? It's three important points. That's biology, aesthetics, and function. But I assume, yeah, most of you guys would have had read this in your textbooks during your graduation BDS and DDS and stuff. But according to me, this is bullshit because you do not have any biomimetic principles that you follow when you place a post, because pulp is a tissue which is quite like soft and flexible and very less resilient. And on the other hand, post is usually made of material which is very stiff. So and you exactly place a post where you have your pulp chamber, so definitely you're not following any biomimetic principle. Talking about aesthetics, yeah, during older days when you used to have metal posts or carbon fiber posts, and you had only feldspathic ceramic as your restorative material, the metallic part, the grayshness of the metal or the carbon fiber post used to be seen through. So yeah, aesthetic was a concern back in the 90s till the time lithium disilicate and zirconia wasn't introduced in dentistry. But with latest zirconia and with latest lithium disilicates, you definitely have opaque materials which are opaque enough to mask the pores. Also, this company Angelus has this amazing composite opaquer called opaque, which can be used to mask the metal posts as well. So aesthetic is also out of question. So the only thing that a post serves is function, function, and function. That's the only reason why you place a post. So what does a post do basically? It holds the core. That's universal. Everyone knows that. This is an academic point. I don't think it holds a lot of value. It holds itself to the core. And the third reason, third point, what does a post do is it holds itself to the tooth. Basically, if the post doesn't hold itself to the tooth, it's in no way going to support the core. So there's no point. So it has to hold itself to the tooth. Now let's take a very simple example about German and Japanese engineering. Nothing against their countries, but yeah, as it's a universal thing that their cars or machines, the German cars or the German machines, they are very sophisticated. They are fun to use until and unless they go kaput. The moment they stop working, it's gonna burn a hole in your pocket. Whereas on the other hand, Japanese engineering, it's simple, long lasting, and cost effective. And similarly in dentistry as well, if you're performing simple procedures like crowns and bridges, there's hardly a couple of interfaces involved when you do such procedures. But whereas if you do procedures like cast posts, there are at least six interfaces involved. The six interfaces namely would be the interface between the tooth and the core, the interface between the core and the post, the interface between the crown and the luting agent, the interface between the luting agent and the crown and the core basically, the interface between the luting agent and the tooth, and the interface between the post and the tooth. So these are at least six interfaces, not considering the fact that there's some interface between the luting agent and the tooth, and we are not using any opaquers and stuff like that. So the more the interfaces, more are the chances for you to go wrong. Hence, it is of utmost importance to follow the proper protocol and be very wise while choosing your post and core systems. Every tiny alteration in the design of the post will have a huge impact on the final outcome and life of a tooth as a whole. It is always better to avoid catastrophic failures rather than try solving them when they occur. That's right, right? So talking about post, why do we need a post? We already spoke about this. This is basically the first reason to hold the core and to make sure that the core remains adhered to the sound tooth structure. So the other reason why you need a post, it's to strengthen the tooth. Basically, it's a bit controversial. Some school of thought say that that's not the need why you place the post. Some school of thought say that you need the post to strengthen the tooth. But yeah, this study, which was done by Stokes and Hood way back in 1996, let's look at this FEA. Now imagine you're placing a post in an upper central incisor. This tooth is very important for providing anterior guidance. When you see these FEA images generated by Stokes and Hood, it gives a very close, clear picture and idea of which part of the tooth is subjected to maximum loads. Now, as you see, I've highlighted this area of the tooth. That's the cervical area of the tooth. If this is a natural tooth, basically, when there's a natural tooth involved and when there are protrusive movements that you do with your mandible, this movements basically, the majority of the load is exerted on the cervical area of the tooth. That's where the fractures may occur. However, like if you're restoring that tooth with a post, as you can see, I've highlighted these areas. If there's a post in that, instead of that pulp in that chamber there, obviously that tooth is going to be acting like a very stiff agent. And now when you insert a post in this tooth, the geometry and the FEA data changes completely. The post resists these lateral forces and the chances of horizontal a fracture in the cervical region decreases drastically. But at the same time, the chances of vertical fracture of the tooth increases. Now, what are these lateral and torsional forces? The torsional forces basically are rotational forces which cause the tooth to rotate, and lateral forces are basically the forces which act perpendicular to the long axis of the tooth. Not exactly perpendicular, it can be at any angle to the long axis of the tooth as well. So basically, when there are these lateral forces acting on the tooth, there's a chance, if you have a shorter post, if you don't have ferrule and stuff, we'll get to that in a bit, there are chances the tooth can get fractured. So basically, how does a post help resist these forces? It does not solitarily help resist these forces. Ferrule is also of utmost importance to help resist these lateral forces, no matter the post, the quantity, the type, the quality of post used. Ferrule is of utmost importance. Anti-rotational groove helps resist torsional forces. That's the rotational forces. Cross section of the post also helps resist torsional forces. We'll see how. And bond strength to some extent also helps against it. So basically, what's a ferrule? You see the edge of the healthy tooth structure, which is marked with the yellow arrow at the like top, and you see the crown margin, which is marked and again with a yellow arrow. So basically, the distance between this healthy tooth structure and the crown margin is called ferrule. It is not just vertical; it is also horizontal. Uh, Thing that's mentioned in the textbooks. So minimum ferrule has to be 2 millimeters high and 2 millimeters wide. This is mentioned in all the textbooks, but something that's not mentioned in a textbooks is the quality of dentine also plays an important role. Infected or carious dentine should be removed. Affected dentine provides lesser bond strength as compared to healthy dentine. That's logical. Like if you take this lame example, suppose if you have to veneer or place laminate on a wooden plank, and the best of you have the best of resins and you have the best of adhesives, but if the plank itself is rotten, no matter what adhesive you use, no matter what resins you use, your veneering material or your laminate is not going to stick to your wooden plank, rotten wooden plank. But if you have healthy wood, obviously it's going to stick to that healthy wooden structure. So that same principle applies to your tooth also. So most of these companies who measure the bond strength, they measure the bond strength to healthy dentine or healthy enamel. They don't measure the bond strength to infected or affected dentine, obviously, because it makes no sense. So that's the reason the quality of dentine is also very important. That's not mentioned in many textbooks, but yeah, you have to consider this point as well while placing a post. So talking about internal ferrule, there's a new concept called internal ferrule. It's just a retentive feature of the core. It is of significance when you're not inserting the post. Also, some of my colleagues have asked me, do we need to make this feature? Definitely not. Do not try making this by removing the healthy pre-cervical dentine. So you see here, that's the pre-cervical dentine that was left after the root canal treatment. Obviously, if you grind this off to make that internal ferrule, it's criminal. Don't get rid of this structure because it's very vital tooth structure for overall health of the tooth. So now what will happen if there's no ferrule? On the right hand side, you see a tooth which is marked with orange arrow that has no ferrule. But on the left hand side, you mark a tooth with blue and green arrows that has some ferrule over there. So what happens with these teeth is if the tooth without the ferrule is exerted to lateral forces, the force will try dissipating the crown. Now, because the tooth on the left had some ferrule, definitely the tooth structure is going to resist those lateral forces. But on the other hand, on the other side, you see the tooth without ferrule. That tooth is not going to resist any lateral forces, and there will be some catastrophic failures which will occur and which will cause vertical fractures. That's where the fracture most likely occurs. And talking about anti-rotation grooves can be either horizontal or vertical. That anti-rotation groove is a vertical anti-rotation groove. That's a horizontal anti-rotation groove. Depending on where the most wide part of the tooth is, remaining tooth structure is, you can give these anti-rotation groove features. Talking about cross sections of post, now this is a cross section of a Splendor post which the Angelus company has released. You see there are two flat surfaces. Those two flat surfaces provide very good retention and resistance against removal of the post. So the cross section of post also matters. If it's a completely round cross section, obviously it's not going to resist any torsional or rotational forces. That's logic, right? And yeah, that's about it. Talking about the length of the post, how do you measure the root length? Basically, you should not ideally rely on radiographs. Radiographs can the IOPAs can cause distortion, it can cause elongation, it can cause shortening as well. So while performing your root canal, basically you measure your working length, right? So basically that working length for is the basis of how you'll measure the length of the post, which is ideal or required. So basically you measure, suppose now if the working length of a tooth is 16 millimeters, what you do is you subtract the crown height. Crown height is basically the area from gingiva to the incisal area of the remaining tooth structure. So you minus that from the entire working length. So suppose if you have a 16 millimeter long tooth and you have a 7 millimeter long crown, so you minus 7 from 16, so you are left with 9 millimeters. So 9 millimeter would be the root length basically. So now there are two schools of thoughts of how long your post should be. Some authors say that it should be at least half the length of the root, or it should be at least two-thirds the length of the root. So now you have got got your root length of 9 millimeters. So how do you calculate how much of a post length should be there? So basically what you do is if you're following the school of thought where it should be 2 by 3, you multiply 9 by 2 by 3 and you get 6 millimeters. That's how long the post should be from CEJ. And if you're following the school of thought where it should be half the post length, the should be half that of the root length, you multiply 9 by half, you are left with 4.5, but it should be at least more than half. Okay, so you round it off to the nearest number, that's 5. So 5 millimeters should be the length of your post ideally. You follow either school of thoughts, they work equally well. They have studies have shown promising results with both the systems. And talking about this cast post here, you see this length, like root length, it's denoted with this yellow arrow. And if you see the post length, it's denoted with the red arrow. The cross section that you see with the red arrow, the cross section of the tooth that you see, red arrow is hardly one-third the length of the root. So what happens in this case is the like forces which come on that crown and the post, they are transferred to the post, and post in turn transfers these forces to the tooth, and tooth in turn will transfer these forces to the alveolar bone. But because the length of this root is so short, there's just it's just that red portion over there, the forces which will get transferred to the alveolar bone will be much lesser, and this may cause fracture in future. So definitely post length plays a very vital role. Talking about post diameter, the golden rule for all cases is preserve as much cervical dentin as possible. Do not take tooth structure out to make space for the post, and also choose a post which fits in after removal of obturation material. Do not try to remove the tooth structure for making place for the post, obviously. Also, when you do root canals, clinicians have to take this very important point into consideration. Clinicians place a high value on radiographic healing of periapical tissues. This outcome measure may be meaningless to asymptomatic patients who desire long-term tooth survival. Suppose now it's if I'm a layman, if I'm not a dentist, and if I go with a toothache to my dentist, I obviously just expect him to like sort my tooth out. I would like how the radiographic healing is, how my operation is. It seldom matters. The tooth should survive though. That's what the point of the patient would be. So taking that into consideration, you have to make sure that your root canals are also very conservative. Now several studies have proposed that dentine in endodontically treated teeth is substantially different than the dentine in vital teeth. It is thought that dentine in endodontically treated teeth was more brittle because of water loss and loss of collagen cross-linking. However, more recent studies dispute this finding. Young et al. In 1991, way back in 1991, compared the physical and mechanical properties of dentin specimens from teeth with and without endodontic treatment at different levels of hydration. They concluded that neither dehydration nor endodontic treatment caused any dehydration of the physical or mechanical properties of dentin. There are many other studies which prove the same. So basically, your tooth doesn't get desiccated or anything after root canal treatment. It doesn't lose its strength because of the root canal treatment. It loses its strength because of the preparation or the cavities that led to root canal, or because of the tooth that was lost because of that cavity, or because of the tooth that was lost when you do your axis openings and when you do very wide axis openings and stuff like that. Also, another important thing to consider is what kind of taper you use while doing root canals: 2%, 4%, 6%, or 8%. So, talking about like being minimally invasive, just check your IOPs, check your CBCTs. What you feel is adequate, only go till that. It does not like if the wider you, it does like it's not the concept that the wider you prepare, the better would be the outcome of your root canals. Try to be as conservative when you're taking your tooth structure out. This pre-cervical dentin that you see, which has been marked with the probe, is of utmost importance. Try to be as minimally invasive with your access openings. On the like right hand side, you see this tooth over here. Both the tooth belong to the same patient, has been treated in the same mouth. The IOP over here, you see how wide the access opening was, and you see how minimally invasive this access opening is. So obviously, the remaining tooth structure over here, the dentin, the pre-cervical, pericervical dentin over here, is much more as compared to what was left over here. So logically, this tooth is going to have very great, very like much better outcomes as compared to this tooth because of the remaining vital tooth structure that the dentist was able to preserve. Now let's come to this major topic called flexibility of post. What happens when the post is flexible? So earlier days, cast post or metal posts have been discouraged because they were not flexible. Then came fiber post. Fiber post also had some disadvantages. They proved to be too flexible. So basically, when you insert a post in the tooth, now let's consider these two different tooth surface, like two different teeth. On the tooth on the right hand side, left hand side basically denotes a very wide tooth, a very long tooth. Tooth on the right hand side denotes a very tiny tooth, maybe a like lower lateral incisor. This tooth may be denoting an upper canine. So because this tooth is wide, it's going to be a bit less flexible as compared to this tooth. Now if you compare tooth of different lengths, a longer tooth is obviously going to be more flexible than a shorter tooth, right? Now talking about the width also, sorry, a wider tooth is going to be a wider tooth is going to be less flexible as compared to a narrower tooth. Upper molar or lower molar is not going to be as flexible as your lower incisor, right? So when these teeth have different flexibility, obviously you can't expect a post like companies claim that the flexibility of fiber post is similar to that of a natural tooth. That's never the case. A longer fiber post will be a bit more flexible as compared to a shorter fiber post. A wider fiber post obviously is going to be less flexible as compared to a narrower fiber post. Now, when you have so much differences, imagine you're restoring a canine with a very narrow fiber post. Obviously, the fiber post is going to be a bit more flexible as compared to canine. And when you're restoring a lower lateral incisor with a very thick fiber post, the fiber post is going to be as a stiff material as compared to that of the lower lateral incisor. So what will happen, because due to this difference in flexibility, if you have enough ferrule, there's nothing that's going to happen. The fiber post is going to retain the core. But if you do not have a ferrule, what will happen is there is going to be a failure between the bond, between the bonding agent, basically the bond between the post and the resin cement, or resin cement and the tooth, that is going to start fracturing. So that's a small video. You see how that fiber post was flexing just with two arteries. So what will happen if you use a fiber post and if there's no ferrule? What will happen is basically when this tooth is exerted, this tooth has no ferrule. This is a cross section of a tooth without ferrule and very short crown margins and stuff like that. So when this tooth is subjected to lateral forces, the bond between the post and the resin core, basically the luting agent, is going to start failing. And because there's this failure, there'll be some, when there are lateral forces acting on the tooth, there will be some movement between the crown structure which will start over a period of time, that will cause all the bacteria and all the agents to enter, to creep in, and because of the bond failure. And once the bacteria and the saliva starts creeping in, that area is going to face issues like secondary caries. And because of issues like secondary caries, there's also the secondary caries, because they're located underneath this crown structure, the patient will not be able to maintain that structure. So remineralization is out of question. And because the patient is not able to maintain that, this will keep on progressing, the disease will keep progressing, it will ultimately reach the core build-up material, and ultimately the fiber post will come out with the crown will come out with the fiber post. And I think that's most of the cases where, like in most of the cases where there is not much ferrule, this happens. So how do you avoid this? You can use this metal post from Angelus. It's amazing post called Refor post, or you can use adjustable, single adjustable post called Splendor. This is the major advantage of Splendor post. Now if you see here, if it was a very wide canal, this post has a sliding sleeve. The sleeve can be slided up and down. So because now see, if you are using a tooth, if you are using it in a tooth with a very wide canals, this sleeve will pass exactly at the apex of this post. And because of that, this area is going, this entire post as a whole is going to be a lot less flexible as compared to this one, or this one in a progressive order. This post over here is going to be much more flexible as compared to rest of the three posts. So that's the beauty of this Splendor post. The flexibility of this Splendor post is also variable, the tensile strength basically. So Splendor is the way to go. How? That's it. So if it's a narrow canal, the sleeve is not going to go all the way in. If it's a medium canal, it will go like medium way in. And if it's a very wide canal, it will go all the way in. So that will give a difference in flexibility. And this difference in flexibility is very important. So what do you do if you don't have a 360-degree ferrule? Don't hesitate to go subgingival to gain some ferrule. Gingivectomy, crown lengthening procedure, or vertical preps can also be done. Although a bit technique sensitive and time consuming, and with additional lab costs, cast post or dowel crowns are also an amazing solution. Or simply use adjustable post system like Splendor. They also work. Sorry. Now talking about cast posts, let's get going. Like let's talk about this case which was referred to me. That molar was endodontically treated. The patient complained of fractured tooth in lower right back region after root canal treatment. The tooth was examined to rule out chances of vertical fracture. There were not, luckily, fortunately, weren't any vertical fractures. This is the pre-op IOPA. The canals were prepped using number 2 and number 3 piezo reamers in mesiobuccal and distobuccal canals respectively. A wax pattern was made using GC pattern resin and a prefabricated post. The Angelus pin jet system was also used for fabricating and for using with this pattern resin. Casting was done using nickel chrome alloy, which was later sandblasted. The prefabricated post was also sandblasted using 50 microns aluminum oxide, and a small slot was prepared. We'll get to it later, why the slot was prepared. Now the tooth was isolated before the cementation, before the post cementation using a rubber dam. That's how it was done. And this is the trine of the cast post. That's the trine of the prefabricated post. And resin modified GIC was used for luting this cast post and this whole assembly. So this is immediately how it looked after cementation. Now the slot which we spoke about on the which was made on the prefabricated post helped in removal of the occlusal handle without using any air rotors. This prevented unnecessary vibrations to the cement, which almost takes like, see, the thing is, you can't use like light cure cements. Light is not going to penetrate through that metal and stuff. So obviously you need to use dual cure cements when you do your cast post. So because you don't need like, because the cement, like when you use dual cure cements, the cement usually takes 24 hours to set, and before that, if you have any vibrations that comes through your air turbines or your electric handpieces, those vibrations will cause bond failures in near future. So to avoid that, you make all such provisions. And this is after removal of excess cement, how it looked like. This is after the tooth prep. So basically, we spoke. The fourth point we spoke what you do when you don't have a 360-degree ferrule. The fourth point was use adjustable post system like Splendor. They also work amazingly well. So what does and how does it work is, like, if you want, so we will get to how it works in a bit. So basically, cast post is a very good solution, but if you want to avoid the hassle, the simplified sliding post solution from Angelus works equally well. The issue with cast posts is it's technique sensitive. It involves a lot of lab steps. It involves extra costs also, extra appointments also. So that's the reason that is a bit shortcoming of using cast posts. So Angelus, a pioneer company and specialist in research development and manufacture of fiberglass products for dentistry, has launched this new generation of fiber post. The development of this technology was the result of a comprehensive and thorough study of current fiber post techniques, the deficiencies and difficulties in their use. The first challenge was to reduce the drill and post shapes and size, offering a dynamic size that fits in different canals morphology. The second was to develop a system that fits properly to the cervical morphology, an area that normally presents more amplitude. The use of traditional posts resulted in lack of adaptation in this area, which may cause post failure. As a result, Angelus has developed this universal system called Splendor SAP, that's single adjustable post, consisting of only one drill, one post, and one sleeve. This solves the first challenge by decreasing the inventory of various drills and post sizes, and by adapting to narrow or medium canals and filling the cervical area of the preparation with fibers. The second challenge was also solved. Additionally, Splendor single adjustable post allows minimally invasive preparations as well as provides greater mechanical interlocking, increasing the retention between the post and canal walls in addition to the chemical bond. Also, the post has a patent which is granted and registered by Angelus. It inaugurates a new era of smart posts since it follows two trends in dentistry: simplification, that's the use of single adjustable post, meaning a universal size for narrow, medium, and wide channels. You don't need to have a lot of posts in your armamentarium, different sizes of posts and stuff, and a minimally invasive approach as it allows the adjustment of the post to the canal and not canal to the post. Definitely, as we spoke, like, you do not need to make space for the post. Your post has to fit the space that has been created after removal of the obturation material, which results in the absence of minimal removal of dental structure and avoiding to decrease the root structure resistance. That's preserving the pre-cervical dentine that we spoke about. And talking about the composition, the post and sleeves are made of fiberglass and epoxy resin. The best part about this post is it is radio opaque also, and that's the dimensions of the post. It's not a constant dimension. The dimension can keep changing. The flexural resistance, the methods were like there were different tests performed, and the use of the sleeve increased the maximum post separation force by almost 3 times. This is as compared to other like other fiber posts or your metal posts as well. And talking about radio opacity, that's the best part. Most of the fiber posts what I've used till date are radiolucent, but this post is radio opaque, so you can make your IOPAs and you can determine how long the post has gone inside the tooth. And talking about glass fiber distribution, this is also one of the very important features of this post. The microscopic photo of this cast post cross section was made, and you can see how evenly the fibers have been distributed in the resin matrix, right? So that's a very important thing when you consider fiber post. The more the fibers, the better would be the strength of that post. And that's about it. And talking about 5 reasons why you need Splendor post. First reason is it's universal. It's single size for narrow, medium, and wide canals. It's anatomical. it adjusts to the shape of the canals, and there's increased retention because of the mechanical interlock cross sections which I showed you. In addition to the chemical bonding, obviously, it's minimally invasive. It does not require any canal adjustments. You use your basic GG drills, or you use your uh, piezo reamers, or even if you use your like the heated compaction techniques for your root canals, if you use that heated probe, basically to remove your GP points, that's also more than enough for making space for this post. And low risk of root fracture. The major disadvantage of using metal posts is it causes catastrophic root fractures. So because the modulus, elastic modulus of this fiber post is going, it's variable and it's going to come as close to tendon as possible, there is going to be a low risk of root fracture. And that's how the procedure for Splendor is performed. Here we are making space for the post using a size 1 piezo reamer. That's all. Nothing more than a size 1 piezo reamer. You don't need special burrs also. So that's the post space which has been created. This is how it looks after etching. After cleaning the chamber, that's how the post space looks after etching the tooth. You see the remnant GP point at the apex of the root, right? This is going to be restored with the Splendor post. So that's how I train the Splendor post first to mark or to make that slot or to cut the excess off. That's the inner sleeve that goes inside the chamber, the pulp chamber. And now I'll be using the outer sleeve. I'll be placing the outer sleeve on that tiny inner part and try to push it as inside as possible. Then I perform the markings, and like that's a animated video. I perform the marking. That's an animated video which will give you a very like fair idea of how the rest of the procedures I have to perform. Use any piezo reamer, any gets grid and drill, as I told you. You can even use a heated probe to remove that obturation material. That's the inner sleeve of the Splendor post. Trying it in. Just make sure it has reached the GP point by making a radiograph if required. That's the outer sleeve which is going in. You do your markings, you measure where you do the markings where exactly you want the post to end. That's the marking which has been done. You cut the excess off because after cementation, after bonding, obviously you do not pass these vibrations to the tooth. You check for occlusion. There shouldn't be any interferences as such. You silent the post. Recent studies have proved that no matter which post you use, if you even if it's a metal post or a carbon fiber post, if you're using silane, the bond with that resin cement is going to be increased considerably. So whichever post you are using, you get amazing silane, like a huge bottle of silane from Angelus at a very nominal cost. So get your silane from Angelus and apply it on the post, whichever post, no matter which post you're using. Fill in the chamber using your resin cements. That's how you place the inner sleeve first, and then you slide the outer sleeve over that inner sleeve. That's it. And then just do the core build up using your same resin cement. That's how simple it is, right? So you need not have size 1, 2, 3 fiber posts. You need not have different sizes of posts. That like simplifies the procedure considerably. You need to have just one kind of post in your armamentarium. You need not have post drills also to coincide with that exact space. You can use your basic sleeve, basic piezo reamers, your basic glade and drill, and the post which you would be using. Obviously, it's going to adjust itself to the pulp chamber basically. So yeah, that's about it, guys. That's my practice. I'm a prosthodontist. I have my own dental clinic at Mumbai, India. I have my own dental lab as well called Serra Life. It's a complete digital dental lab and also a full-fledged analog lab as well. I have my own press furnaces. I have my own casting machines also. So that's my practice. That's how I do my consults. If there are any questions, you can get back to me. That's my QR code for my Instagram profile. You can definitely message me on Instagram and talking about when this post would be available in our country or your countries. Basically, I had a few queries coming into me. You can definitely message Angelus as well on the Instagram page. That's the QR code for Angelus as well. And definitely get back to us if there are any doubts. Thank you.